Hello everyone, my name is Dr. Irfan Majid and I'm working as an endocrinologist. The purpose of my talk today is to describe about fine needle aspiration biopsy of the thyroid nodule. For this reason, I divide this talk into the following subheadings. What is thyroid gland and thyroid nodule? What is fine needle aspiration biopsy? How it is performed? How to prepare the patient for the procedures? What are the possible expectations after the procedures? What are the possible results? And finally, we will conclude this session. So let's start the presentation. What is thyroid gland? Thyroid gland is a butterfly-shaped endocrine gland located in the lower front of the neck. It makes thyroid hormone which are secreted into the blood and then carried to every tissue in the body. Thyroid hormone helps the body to use energy, stay warm, keep the brain, heart, muscle and other organs working. What is thyroid nodule? Thyroid nodule refers to an abnormal growth of thyroid cells that form along within the thyroid gland. Epidemiologic studies show the prevalence of these thyroid nodule to be approximately 5% in women and 1% in men. In contrast, ultrasound can detect thyroid nodule in 19 to 68% of cases. The clinical importance of thyroid nodule rests with the need to exclude thyroid cancer, which occurs only in 7 to 15% of cases. What is fine needle aspiration biopsy? A fine needle aspiration biopsy of a thyroid nodule is typically performed under ultrasound guidance. The procedure is simple, safe, and usually performed in the doctor's office. During the procedure, patient may feel some neck pressure from the ultrasound probe and from the needle. Patients are advised to remain as still as possible and avoid coughing, talking, and swelling during the procedure. Preparing for thyroid FNA. Most of the regular medicines can be continued except the anticoagulant, which often needs to be stopped temporarily before the procedure because these can increase the risk of bleeding. Patients are advised to receive general instruction and ask any question prior to the procedure. Generally, patients are not required to fast on the day of the appointment. Patients are advised to wear comfortable clothing and take off any jewelry from around the neck before the procedure. How FNA performed? Clean the neck with an antiseptic, a local or topical anesthetic applied. For the biopsy, a needle is inserted through the skin and into the thyroid nodule. Usually 2 to 6 samples are taken as they increase the chances of finding out cancerous cells if present. If there is a fluid in the nodule, a syringe may be used to drain it. Once the biopsy is completed, pressure will be applied to the neck. The procedure usually lasts less than 30 minutes. It usually takes from few days to 2 weeks to get the biopsy result back. Possible expectations post-procedure. Most patients typically feeling well. Some neck discomfort at the site of the biopsy is expected after the procedure. Acetaminophen and ice compresses can be used to relieve the discomfort. Possible results: benign. This accounts for 70% of the biopsies. The risk of malignancy in this group is typically less than 3%. These nodules are generally monitored with a follow-up ultrasound within 18 months and if needed, periodically after that. Malignant, cancer. This accounts for 3 to 7% of all biopsy specimens. There is a 97 to 99% chance that it is truly a cancerous lesion. The most common type of thyroid cancer seen is papillary thyroid cancer. Almost all of these nodules will go for surgery. Suspicious for malignancy. There is a 60 to 75% chance of cancer. There are features suspicious for malignancy but not diagnostic. The treatment is typically surgery. AUS or FLUS, undetermined significance. These categories may be alternatively called indeterminate. These specimens have some mixed features. This diagnosis accounts for 5 to 15% risk of malignancy. A repeat biopsy or genetic testing may be useful in these cases. Follicular neoplasm or suspicious for follicular neoplasm. This category carries a 15 to 30% risk of malignancy. It is difficult to tell if the nodules are benign or malignant unless it is taken out. Non-diagnostic. This means that there are not enough cells in the sample to make a diagnosis. In these cases, the biopsy should be repeated, and if non-diagnostic for the second time, consideration is given to third biopsy, monitoring, or surgery. Conclusion. Thyroid nodule is an abnormal growth of thyroid cells that form along within the thyroid gland. Most of these nodules are benign despite being an increased prevalence. FNA is a simple and safe procedure and typically performed in a doctor's office under ultrasound guidance. No need to fast, and most of the medicines can be continued except a few. The procedure usually lasts less than 30 minutes and results are available within a few days to 2 weeks' time. Thank you very much for watching this YouTube. Goodbye.